So there we have it. Another year is done. And what a year of conversations it's been. To help us round off 2025 for our final episode of the year is Emer Tully, a physiotherapist from Neuro Tour. Emer is here to talk about all things pelvic floor, the importance of this anatomical structure and its impact on singing, signs of a tight or weak pelvic floor in all performers, the aim of a physiotherapist when working with the pelvic floor, and how physiotherapists and singing teachers can work together when there is a singer involved who needs some focus in this area. Before we get into it, we want to say some big thank yous to all of the guests who have given up their time and shared their expertise with us, to you, the listener, and to you, the watcher over on YouTube, for all of your subscriptions to our YouTube channel, for keeping us company every week. It truly means the world to us. This podcast is our little pride and joy, and we hope that it's been able to bring some creativity, inspiration, knowledge, and a little bit of fun into your teaching life. We will be back with a new 2026 season on the 14th of January, and we look forward to seeing you there. However you might be spending this particular period, we send you lots of warm wishes, and we'll see you on the other side. Emer Tully, we are so ready for you. Emer, what would you say is your favourite problem to work on when a singer comes into you for physio?
As in vocal problem, we're talking?
Yeah, or like body bits. What's your favourite thing?
Okay, so, I really have liked to look at the biomechanics and anatomy as a whole. And I've done vocal physiotherapy for coming up to 10 years, like eight or 9 years. And, have started very much around the neck and the larynx, and have just gradually worked all the way out to the rest of the human body. After a period of time, I started looking into mainly women's health, but also pelvic health, and realized there were so many crossovers. So now I think my favorite thing is addressing someone's breathing mechanics and specifically looking at the function of someone's pelvic floor and linking it to all sorts of problems, whether it's tension in your neck and shoulders, whether it's issues with pushing and not being able to find kind of support when you're singing, or it could be lower back pain, hip pain, etc.
Have you got like a favourite muscle? Because I came across one recently and I love it simply for its name, the bulbospongiosis.
I know the pelvic floor muscles are really fab. Is it a dinosaur? Is it a pelvic floor muscle? That would be a very good Christmas pub quiz. But yeah, do I have a favourite one? We have some fantastic muscles throughout the body. I like serratus anterior, bulbocavernosus is another good one for the pelvic floor.
Yeah, I'll probably get that one out as a tongue twister for students. Educational and fun. Can you tell us a little bit about how you got into physiotherapy and how you came to work with a lot of singers in particular?
So I qualified from Manchester 10 years ago. And after 2 years of working in another clinic, I was kind of put myself forward to be a physiotherapist for a touring show. So that was Shrek the Musical, which is, 8 years ago now. So I toured with the company, and that was my first experience with theatre, with singers, performers, and also just navigating what it's like being backstage, helping performers, also trying to communicate with company managers and producers. And when I say performers as well, that includes all of the crew. So you think of all of the team that's involved in putting on a show, you're going to have very different anatomical issues, whether you're dancing on stage or whether you're calling the stage or you're on automation. So that was the perfect insight. So I was doing that for a year, and then I did a tour in China with Cats the Musical, and then came back to London and have since mainly worked with performers, or at least worked for companies that have that as a specialism. But I have lots of referrals from different ENT consultants. And so the people that come into me with vocal issues aren't always your classic leading ladies who are singing really intense songs. They're also teachers who are talking all day. They are ensemble who are having to sing as well as be in a corset and dance for a 4-minute number. So it's a really broad spectrum of people that I see, but there's some things that will be the same for every single person and other things that we need to adapt to each individual.
You mentioned before that pelvic floor, women's health, that's been something of intrigue for you. Why this area in particular?
So, like I said with the voice, I started looking at the effects that different parts of your anatomy would have on the voice. And I think I started kind of branching out from this, going to other areas of the body. And the pelvic floor was something that I had always included, but at a very basic level, I would say, for vocalists coming in. I was actually working on a show and, having worked for 10 years, I had a patient come in who revealed to me that she was prepartum, so she was pregnant. And I just thought, this is a real gap in my knowledge. And, anecdotally, I'd been speaking to women who were perimenopausal, prepartum, postpartum, or even just due to hormonal imbalances during their adolescence and when they're training, and thought this is really something that I need to understand more. So I went on a mummy MOT course, which is almost like the kind of gold standard for women's health, particularly when it comes to physiotherapy. And I was just so surprised by all of the links between what we would want to be doing for someone post-pregnancy and the stuff that I was trying to teach. And I felt like it was so many crossovers, but it just did it so much better than what I was doing. And a lot of that comes down to the function of your pelvic floor and ensuring that you have synergy between it and your diaphragm. And if the two are working together, we are going to have improved respiratory benefits. And when you're a singer, that's what you need. You need that breath support, you need that control. And the stuff that we're doing for someone that's just given birth posturally is nearly identical from what I would be doing for a singer, ensuring that your thoracic diaphragm and your pelvic diaphragm are on top of each other and working together. That was a bit of a sweeping statement. There is so many more things that have happened to a female after she's given birth. But in terms of what I'm trying to do for that individual posturally and for their respiration, that is what mirrors somebody else coming in that I see who doesn't have that stability or is hypermobile and also might be having some pelvic symptoms.
When teachers think about the diaphragm and singing together, we probably think more about that thoracic one, this dome-shaped muscle that acts as a bit of partition between the thorax and the abdomen. But we have multiple diaphragmatic domes, don't we? Can you talk to us about those in the body and why they're just as important?
So again, this was something that we spoke about during this course I did, and it's a kind of osteopathic interpretation, but it's also something that's been used in a lot of like Chinese medicine. So there is this idea that we have 5 diaphragms within the body. So we have your thoracic diaphragm, which you mentioned, the one that we all know, but your pelvic floor is a very similar kind of hammock setup as is your thoracic diaphragm. So they would be the two ones that I try to work on mainly, but the other 3 involve your foot. So you're at the kind of dome of your intrinsic foot muscles. Again, really crucial, really interesting to think about how that affects the rest of our kinetic chain and anatomy, and therefore how maybe something around your thoracic diaphragm is influenced. Your tongue is also considered one. Again, I heard that in the course and thought, wow, that's so interesting, because obviously I work a lot with tongue tension and tongue positioning with my patients. So, the idea is that if you've got tension in one of those diaphragms, maybe we have tension or increased tone in another one. And then the final is your brain. So these are purely based on the setup of this group of muscles, which is why they're considered similar. Typically, when I look at someone, I am looking at you from the tips of your toes to your neck and above. So it is interesting. You do see similar patterns through people. Again, hypermobile patients are mentioned, and we typically find that there are more females who are hypermobile. Your sense of proprioception and balance is slightly different in those individuals, and we definitely do see changes throughout those diaphragms in those individuals and also in a lot of the population that I see coming into clinic.
We have a great video with Jenny Morton in our Knowledge Hub about the feet and how she might work with someone who might have like a flatted dome in the foot, and how doing certain exercises can help kind of create the dome that we want, and how it then affects sort of the fascial trains above. So there might be exercises to do with the feet and the pelvic floor and how we allow the diaphragm in the thorax to work efficiently. How do we help the brain one?
I mean, that could be balance. Your brain is the control center for your central nervous system. You know, I heard a lot of singing teachers. I think we spoke about this working on a wobble board. And that's going to be a fantastic way of working all those diaphragms. We're trying to ensure that we have reduced tone in some areas, but we have that kind of kinematic system and proprioceptive system working. You know, that's intrinsic strengthening. That's definitely pelvic floor should be firing up in those moments. And if you're breathing, then we know your thoracic diaphragm is engaged. If you're singing, your tongue is doing something. So that, I think, would be a perfect way of aligning those 5 diaphragms.
I've really loved the wobble board recently in sessions for kind of anyone really who needs a distraction. But if somebody is visually quite tight or held, or would require a bit more buoyancy in their body, getting them on the wobble board and having a little bit of a jiggle around has proven to be quite useful, anecdotally anyway.
Yeah, no, I completely agree.
What exactly is the pelvic floor there for?
So it has a few functions. So it's there as one of the main supports for all of our internal organs. Again, very important. It helps to control bladder, bowel, and also sexual function. Again, all 3 really useful and also really helpful when it comes to working out whether somebody might be symptomatic and might have some signs of pelvic floor changes. Is also useful for pressure regulation. So exactly what we're talking about with your breath control and abdominal pressure. Oh yeah, and this stabilizes the pelvis and the spine. So it's there to create that nice stability, which is why some people will have symptoms through their hip or their lower back, and that may be linked to something that's happening within the pelvic floor.
How does it differ between women and men?
So typically men will have thicker musculature throughout their pelvic floor. We have similar muscles, but our pelvis is also shaped differently. And obviously the most critical thing is that a female is built to be able to create a child inside of her. So she's much more reliant on ligament tension rather than just the muscles, because if she had really thick musculature, it's much harder for them to be able to stretch in order to be able to accommodate a growing fetus. So yeah, I mean, we all know that a female goes through huge hormonal and anatomical changes prepartum, and it's your pelvic floor musculature that needs to be able to adapt.
Can we just touch upon that? Because many performers who have birthed a child might be looking at how to go back to work after that period. What might have changed in their body, and what are we helping them? We, as if I'm a physio, Emer. What are we helping them back to after childbirth?
The more that I've been treating postpartum women, the more it just is such a clear gap in our health service. And that is not blaming the NHS. They don't have the funding. So we have some fantastic women health and male health physiotherapists, but you typically will get signed off after 6 weeks after giving birth. And obviously it is one of the most natural things to go through. However, we should not presume that our bodies just bounce back after those 6 weeks. There have been some significant changes that can be lifelong, which isn't to scare people, but But is a reality, and it just requires some simple advice when it comes to strengthening and lifestyle changes, even to help someone find their baseline again. Might not be the exact same as they were before pregnancy, but a lot of it will come down to strengthening. There's lots of good things that we can be doing, and particularly for singers, because one of the biggest thing that changes is that base of support. Your hormone levels have drastically changed. It can take up to a year for them to come back. So I speak to women who tell me stories about, auditioning 2 months after giving birth. And I think, God, that is such an area where I don't think there is clear, succinct advice. When do we return to a show? Should we be returning? Say your crew, should you be returning after 6 months after giving birth? I don't think there is very, very much clear guidance. I don't think that there's any clear rehabilitation protocol. Now, if you had surgery for an ACL is a knee injury. It wouldn't cross your mind that you would be able to have the surgery and then do no rehab and 3 months later expect to return to your job and be fine. You could go in for any surgery, and it could be surgery of your big toe or, a muscle tear. You would know that I might need rehab after that. But it's so odd that we've had this very systemic change. This isn't just one area, your entire body has changed. And yes, it starts to return to normal, but there are lots of things that we need to be just assisting it in order to really recover properly.
Can we talk about the symptoms of somebody who might present with a tight pelvic floor versus a weak pelvic floor?
I think this is really important. I go on my Instagram and I have people pop up and tell me to do what we know as Kegels. So engage, engage, engage. Now, for a lot of dancers, the problem is not that you have a weak pelvic floor. It's often because you have tension through that area. And we hold tension throughout our bodies. The same way that when you are stressed, you'll often say, oh, I'm so tight in the top of my shoulders. Very similarly, we hold tension through the pelvic floor when we are stressed and anxious. Tight clothing and clenching through the stomach will increase tone through the pelvic floor. If you sit cross-legged lots, that will increase tone through the pelvic floor. So there's lots of things that we are doing that can create that tension on top of then postural changes. Now, annoyingly, the symptoms for a tight pelvic floor and a weak pelvic floor do have some overlap, but I'll just run through some of the basic ones. So if it is that you have a tight pelvic floor, then you might experience some pain either through your hips, lower back, or during intercourse. It could be that you suffer with constipation, or you have a lot of stiffness into your hips. It could be urgency, so that's urinary or full incontinence or leakage. Then going on to weakness, again, we might have leakage. There could be signs of pelvic prolapse, again, more common postpartum. It could be decreased sensation, and you might notice that during intercourse. And again, it's pain in the lower back, hips, and the tailbone. I always think of your muscles wanting, if you kind of interlace your fingers, you kind of want your fingertips all touching together, one on top of the other. If I bring my fingers in together, we're going to imagine that's a shortened state of the muscle. If I bring my fingertips kind of further away from each other so there's space, that's a lengthened one. And in both of those positions, we just don't have that reactive flexibility to be able to respond to the needs of our bladder, bowel, and organs. So we need that adaptivity. If it's too lengthened, it's harder to contract. It's harder to maintain that contraction. If you're too tight, you aren't able to get that same strength because it's gripping and in a state of really high tone.
And why would that have an impact on singing? I know we spoke about breathing and support, but what could that manifest in vocally?
So vocally, the biggest one that I would see is that you're unable to get a deep grounded breath. The classic things that I see is either someone coming in and saying to me, I'm seeing my singing teacher and they want me to do lots of breathing into my belly. And I watch them do it and they are just forcing, creating this huge dome, thinking that that is what is being asked of them. It should feel really natural breathing into your belly, should feel easy. And if you are not in the correct alignment posturally, you're not going to be able to do it. And to me, that is a huge sign that your pelvis is not in the correct position. And from that, you're going to have some changes into your pelvic floor. It could be the endurance muscles or it could be the fast twitch muscles, but something's going on there. If your pelvic floor isn't able to kind of move with you, chances are your diaphragm is not doing it either. And that's not something that I necessarily need to come into the pelvis and work kind of internally with your pelvic floor. It might be that I actually need to change what's going on through your spine and the way that your rib cage, your thorax is set up. So what we want is for your thoracic diaphragm to sit directly over your pelvic diaphragm so that that breath can get in. Vocal fatigue, needing longer to warm up, vocally, tiring faster, all of those things would be symptoms.
For either of those sides of the coin, what could either singing teachers do or the singer themselves do in order to help either tone it or to sort of reduce the tension in that area?
So there's a few things. Obviously, I would recommend coming in and seeing a physiotherapist first, just for us to assess. Because if you are that person with a really tight, guarded pelvic floor and you start doing Kegels, your symptoms will worsen. It's not going to be a useful thing for you to be doing. So it's important that we ensure what's happening, why it's happening, and then start there. But the basics that we can do, which is something that I will always look at, is the rest of your anatomy. So I think, yes, we want to be able to get a diaphragmatic breath, but it's also really important that we are able to expand 360 through your rib cage. Another classic thing that I see is that with a lot of dancers, performers, anybody that has trained in dance through their adolescence, because they're typically up and moving more, they are often in this kind of rib flare, chest up position. Their pelvis is tipped forward. So we call that a lordotic or an anteriorly tilted pelvis. But it basically means that your lower back is curved. It's almost like that kind of duck posture, chest up, curved back. And in that position, you cannot expand into the back of your rib cage. But I mean, sometimes you get a combination of both. Someone that has, and this is where, when I see people when they're starting a new contract and they've just spent a month chilling at home, which they absolutely should be doing. But, you get that, you sit down, you've got tightness into your hip flexors, thoracic rib cage is all compressed, our pelvic floor is tight and not working as effectively, and then suddenly you're back into that rib flare position, arching your spine to create those beautiful lines that we need on stage when we're dancing. Yeah, there can be some real contrast through your body, and so we typically see a lot of injuries during that time. Now, I always think of my role as a physiotherapist, it's obviously very different from what a singing teacher or a speech and language therapist is going to have you do with regards to breath. But the way that I kind of consider my role and think about how I kind of approach this with patients is that what I need is for you to be able to breathe in this way. We are going to start with it being a conscious breath. So I'm going to have you stretch certain areas. I'm going to have you strengthen certain areas. I'm going to have you consciously think about breathing into your back, breathing into your pelvic floor, so that you have access to all of those things. The more we do that, it is going to start to become subcortical. So we know that your brain, your central nervous system will be able to work those postural muscles behind the scenes. So people think when you're singing, I've got to keep everything relaxed, switch everything off. If you actually switched everything off, you would be on the floor. There are postural muscles working all the time. And my role is to give you more of those postural muscles so that when your teacher says to you, switch things off, you are able to switch off some of those overactive, grippy muscles, but you have that lovely base support of postural muscles that are working behind the scene without you realizing that they are switched on. So that's my job. And then when it gets to the technique of your singing or the way that you are speaking, I can then pass you over to that professional, and they're going to have a much easier time being able to teach you some of the techniques that you then require.
Hi, it's Lynn here, popping by with a free resource. If you're a singer who wants to teach but sometimes feels a little unsure or overwhelmed, I've put together some free resources to help you feel grounded and supported as you take your next steps. Just check the link in the podcast description and you'll get an informed, practical PDF guide to help you get started, plus a few follow-up resources to help you feel less of a fraud and more confident in your teaching journey.
And so if we're helping somebody who has got rib flare, what sort of exercises or things would you do to help them get more frontally structured?
So I would never start at the shoulders, because all you'll do is round them forward. What we want is to be able to get a little bit of stability and control. So actually, the first thing, even though this might seem completely unrelated, is often going to be glutes. So that rib flare, you can't really do a rib flare with a neutral pelvis. So, I mean, if you try to do it, you stand up and you flare your ribs out, it's often the change in your pelvis that is the most detrimental to what's happening through your breathing system. So if we change that, if we bring your pelvis back into that nice neutral position, unlock someone's knees, get their quads to be a little bit looser and not that high tone state, and we work more of that posterior chain, so the muscles at the back, then at that point, when that's starting to feel a little bit more supported and we know that their core is switching on and their pelvic floor is doing a little bit more, I then start to think more about things like the serratus anterior, getting that lovely muscle that controls where our shoulder blades sit against our rib cage at the back, get that starting to work, get a little bit more rotator cuff so they're able to create this nice open position without it being too much of that kind of extension and rib flare, and then doing a little bit of our deep neck. So it is a journey, and that can sound really overwhelming, but trust me, when I put it into exercises for you, you'd be surprised how much we can do within one exercise. So it shouldn't be too terrifying.
I think also when we're, as singing teachers, is part of that sort of network, isn't it? We contact the physio, we can be in alignment there. How's it going in your sessions? These are the things I'm doing. Does that feel like it aligns? I think that's so important for us to be able to feel the confidence and the connection to do that.
Yeah, 100%. I mean, all of the singing teachers I work with, I typically send one handover via email and give my mobile number at the end and just say, can we voice note? Does that suit you? And so most of the people, after I see a patient, it's just little check-ins. And I think that's what you want as a patient, because the voice is so multifactorial. It's not just coming in for a vocal massage every single week. If that's what you consider as being vocal health, then I think your guidance might not be as thorough as it could be, because I know what my scope is and I know when to hand over to someone. So, for example, I'm not going to be giving you any technique advice. I would not be the right person for that. That is someone's job, and we want their expertise in the same way that I would hope someone would refer to me when they need my expertise, and I'm going to be able to do that much better.
Some things that I might think about doing in the studio off the back of what you've just said, and maybe you can help guide us as to whether that would be useful and in alignment, are things like if somebody is struggling to find particularly efficient movement in the rib cage because of tightened muscles around the area, doing things like pec stretches, so getting in the doorway and having a little bit of a pec stretch, massaging, self-massage that is, unless you are trained to do so, around the traps and the lats. Also doing some box breathing, which I've come across through Feldenkrais, but we've also got some great podcasts with Lucinda Allen about getting this 360 torso expansion and the wobble board, as we've mentioned. How does that sound in terms of crossover?
I think that's great. And I really don't want to sound too kind of specific about what only a physiotherapist should be doing. I'm very aware that if I sent you to 3 people and you're also seeing me, that is incredibly expensive. And so if there is something that your singing teacher is able to do just to help open you up and create mobility, that's perfect. You can be looking at the basics to work out, is someone in a slightly more rib flare open position, or are they slightly more protracted and then rounding forwards? And we either need to work on creating more space through the front, or we need to work on trying to recenter and reduce some of that rib flare. They're really great places to start, and there's lots of really good options for simple exercises that we know aren't going to exacerbate someone's symptoms. And if those fail, then you can have a think about where next to refer to.
You talked about having things working behind the scenes. So how important is like weight training for a singer? We've had Duncan Rock on the podcast before talking about exercise and singing. I'd love your opinion on that. And what does it uncover about maybe certain methods of vocal support that we might use?
I always say to patients that I do not like coming along and telling them all the things that they cannot do. But sadly, the extremes of weight training really aren't conducive to good vocal mechanics. So if you're going to the gym, you're lifting heavy and you are seeking that kind of bodybuilder anatomical type, that is a lot of typically pushing movements, overhead movements, high load. And typically we get a lot of overpressurizing. You watch someone in the gym and they're often holding their breath as they perform repetitions. That's really not helpful. We spoke about the effects that kind of creating too much pressure through your stomach can have on other structures. And, if you look at someone that does a lot of high level weight training, they've got this slightly protracted posture where all the big muscle groups have been trained and those smaller stabilizing muscles kind of get left behind and are often quite weak. And that imbalance is suboptimal. We wouldn't want that. All of my background is in Pilates. That's where I like to start. But if someone likes going to the gym, there's lots of ways that they can adapt being in the gym that will assist in their vocal health. So it's important that, if I said to everyone, go swimming, 70% of my patients wouldn't do that. So we need to find something that people enjoy, that they're used to, but just adapt it slightly to make it voice friendly. So yeah, if you're in the gym, it is not holding your breath when you're completing repetitions, taking regular breaths. It's not just doing push days, you're doing pull, and then you're also working on those smaller muscles. And that could just be that you're doing a warm-up that involves more functional Pilates-based movements. When you've got that anatomy where it's very high tone, and like you said, when you're going to go into a singing teacher, a lot of what they're advising you is to be able to relax certain areas. So you need to have the capacity to do that. And that becomes a little bit harder if you're doing 5 days at the gym and then trying to sing when you're a little bit fatigued.
Would it therefore be beneficial for a singer who does go to the gym to maybe pick a lighter weight but do more reps of them rather than getting those, well, I say heavy, I'm like 5 kilograms is heavy for me. So going really heavy and getting that blueberry face.
Yeah, absolutely. When I get patients in and we assess how muscles are working, when we find an area that is weak, chances are you're not going to be able to do 15 reps to target that area. So really, when you're doing strengthening, I know this is a big ask, but you should know roughly what is working. People come in, they say, I'm doing 30 squats at the gym and it's for my glutes, but they don't feel their glutes. All they feel is their quads burning. And actually, when I do proper testing of it, their glutes aren't switching on. So when you're at the gym, you should know what you want to be working and you should feel it in that area. Chances are when you start, you are going to need high sets, low reps. So you're doing it less. So let's say some patients, I give them 3 repetitions. So I work out when you fatigue, and often it is that quick. So you've done 1, 2, 3, that muscle has switched off. And at that point, I would want you to stop. I'd want you to wait from anything from 2 minutes onwards and then come back and do another 3 reps. So if the goal is that we're doing 12 a day, you might need to break that down into 4 sessions. And then as you build, we'll be able to do that 12 repetitions in one set where you're doing it the whole way through.
And then when it comes to things like the support strategies that we might be using, there's quite a few across many different methodologies, I'm sure. But what would you say about that as a physio working with certain singers who may use specific support strategies?
I'll always listen to find out what the patient is telling me with regards to the advice that they've already received from their singing teacher or their speech and language therapist, their vocal rehabilitation coach, and I'll try to accommodate. I think it's just really important that you have the capacity to find space anywhere and you're able to engage those postural muscles in all positions. Now, I would love it if you were stood on a flat stage in a perfect pair of shoes and you were wearing loose, baggy clothing and you were stood still as you performed. That's just not the case. You might be in a pair of heels, you might be in a corset, you might be on a raped stage, you might have a wig on your head that's pushing your neck forward. Now, these are not ideal, but I cannot go turn up at a show and say, oh, no heels, no wig, no corset. I can do my best to try to have them adapt things, but chances are your body's going to need to be able to adapt. And so, like we spoke about, it's important that you've got mobility in lots of different areas so that during your choreo, when you're bent forward and you're not able to access your belly, your diaphragm, you're able to breathe into your back. When you're reaching off to one side, you might be able to kind of breathe a little bit more laterally, or when you're upright, you're able to breathe from your diaphragm and have some belly expansion and movement there. So that what I'm training people is more of those postural muscles. So I don't want you to think about squeezing and gripping anywhere because we need movement. It's similar to me telling you to, okay, squeeze your glutes when you're doing an exercise. Okay, if you want to squeeze your glutes when you're doing a glute bridge, that's fine. But do you think a runner is squeezing their bottom muscles every time that they run? No, you're trying to get something to work at 100% when chances are we need it for endurance. And so it should be behind the scenes working at, 20, 30% so that it's able to do the full run or you're able to complete a full song/show. So this idea of squeezing is not something that I advise.
There's a really great quote from Anatomy of Singing. The authors in that book talk about pressure under the vocal folds, saying that the pelvic floor is at once the support for the pressure directed to it, which it must be able to receive without collapsing, and at the same time, an active participant with the ensemble of muscles that generate pressure to create the sound and send the pressure upwards. So you can understand how an imbalance of pressures somewhere, whether that's through a gripped area or too much squeezing, is going to have that imbalance in the system.
Yeah, I think that's perfect. So yeah, getting that synergy with your diaphragm just means that when you're singing and you're doing those long notes, you're able to take one efficient breath and you're able to control that flow of air out whilst producing sound. So if you feel like you're losing that breath or you just don't have the airflow, that's definitely where we start to see problems. And it's also interesting, we've touched a little bit on those like links or anatomical chains, co-activation. I see that a lot as things that I'm looking at. You mentioned some gripping. When your top six-pack muscle is switched on and is in a place of high tone, we will automatically see this co-activation pattern for some of the neck muscles. So gripping in that area, typically I'm going to find tension through your vocal musculature, whether that's your deep neck flexors or your suprahyoid muscles. And I find that really interesting, this co-activation pattern we have around the pelvic floor and other parts of the body. And there's a really classic one between the pelvic floor and the jaw. So tension in through the jaw being linked to tight pelvic floor muscles. Throughout the anterior chain, tight quads, linking all the way up to increase tone through your neck. So I think that's really interesting and just goes to highlight that kind of kinetic chain that we have throughout the body and all of those little links. And also just approaching your voice as a full system.
You mentioned some of the things that could sort of manifest in tight or weak pelvic floor, like the crossing of the legs and things. And you talked about lifestyle changes. What sort of things could we be looking out for in our lives to make sure we're not eating into what's already maybe tense or what is not helping a weak pelvic floor?
I mean, stress is a big one, and that needs its own episode. You know, there's lots of things that you can be doing for stress, but the exact same example, you know, the way that you hold tension in other parts of the body, you are also holding tension through your pelvic floor. So some deep breathing can be really useful. It's one of the first things that I do. It literally ticks everything that we've spoken about, and stress is the other thing that it helps with. When you are breathing from your shoulders, if you take a deep breath in and the first thing you feel rise up is your chest and your shoulders, number one, biomechanically, that is not ideal. Number two, it's cueing in to your sympathetic nervous system that you are in a state of panic. You know, we breathe from our shoulders when we're out of breath, when we're running from a lion. You know, that's affects our hormones. It affects everything that tells us that we are in a state of protection. What we want is to be in that calmer parasympathetic state, your rest and digest state, where you're breathing nice and low. You start doing it and you instantly feel calmer. So stress would be the first point that we could be doing. And, you know, that breath, thinking about being able to breathe into different parts of your back. You know, I often get people into child's pose, get them to focus on breathing into the back. If they struggle, then we'll just do it unilaterally. So they'll take one hand off to the side and they'll breathe into one side of the back. They'll swap, do the other side. Then they'll feel that difference when they're stood up or even just in sitting, stretching through your belly and your hip flexors, again, to be able to give you that nice movement. If you think, God, I am that person that really it is effortful for me to take a diaphragmatic breath when my teacher asks me to, there is tension there. So releasing through those six-pack muscles, the superficial abdominals. That could be a bit of very gentle cobra. Could be seeing a physio. It could be some gentle massage through that area. It could be stretching out your hip flexors in a kneeling position. All of those things will be able to offload. And then we really want to strengthen areas around it. So your body doesn't do things randomly. This tension that people feel that they're so obsessed with, I think we're in this really unhealthy cycle. You know, people come in, my shoulders feel tight. A therapist will massage. 3 days later, back in. How weird. My shoulders, my neck is still tight. Felt great from what you did, but they're still tight. Can we release it again? And you're just in this cycle, and that can be for any muscle in the body. The only reason, other than stress, why you might be holding tension in that area is because something else isn't doing what it's supposed to be doing. So why are your shoulders having to work so hard? Is it because your mid-back and your rotator cuff are a little bit weaker? And actually, if we addressed those areas, your shoulders wouldn't be tight anymore. Because when we come along and say to the central nervous system, okay, massage, okay, that muscle is switched off. Well, unless you just go and lie down in bed for 72 hours, you're going to have to do the same things. So your body needs that stability. And where's it going to get it from? If you don't have other resources, okay, well, I need that muscle again. And so it gets tighter. So I think before people think about, okay, how do I release everything? If you're doing any mobility and flexibility work, it should always be accompanied with something to then stabilize and strengthen, particularly if you're hypermobile. I wouldn't even start on the stretches if you are more on that hypermobile spectrum.
And the stabilizing, is that more of the kind of muscular work?
Yes. Yeah. And that could be just the breathing. So getting your pelvic floor involved. It could be some glute exercises. I do a lot of like mid-back stability work. It could be some deep neck flexor, your nods, to help give you that nice control so that these superficial muscles aren't having to work so hard. The classic thing I see is that you have an overactive anterior chain. So the front of your body is working too hard because you lack stability at the back of the body. So working on exercises for that set of musculature is going to be really helpful. Yeah, that's the same for a singer. It's also very similar when you are postpartum because you've just spent 9 months carrying a large weight in your belly, and so that completely shifts the positioning of your pelvis. If you're not sure what postural type you are, if you sit down all day at work, chances are you are not a rib flare, you're protracted, because sitting down is arguably one of the worst positions for our anatomy. This is not natural to be sat on a chair. We'd either be squatting, kneeling, seated, or we'd be standing, moving for hours and hours. And so it's no surprise that we have changes now through our postural system. Population of prawns now.
We are. Yes, we are.
Open us back out again.
For us who are wanting to find out a little bit more about this world, have you got any resources that you would recommend?
Yeah, I love a podcast, and there's lots of different podcasts out there that are really good for both women's health and, of course, for singers. I mean, Instagram is a great resource. You've just got to be able to shift and find the people that actually have the right qualifications to be advising you on what to be doing in order to change your anatomy. That's a big thing. But the person that I really like for women's health is someone called Dr. Sarah Reedon. She's called the Vagina Whisperer. And like I said, the women's health stuff that I've looked into is not specific to the voice, but as a singer or a singing teacher, you'll be able to take a lot from it, because a lot of the things that you're going to be hearing should be quite similar to you. I mean, that was my experience. The other person that I love, and I've done lots of courses from her, is someone called, well, on Instagram it's Movement 101, but it's spelt MVMT.101. Her name's Michelle Edmison. I think she's Canadian, and she does a lot. Again, it's actually not vocal specific, but it's all about breath. She does lots of foot intrinsics. It's again that kinetic chain through our body, and there are so many exercises from her that I absolutely love. They are functional, they're not grippy. She involves your pelvic floor, whether it's an exercise for your foot, your neck, anything. So we are getting those kinetic lines engaged, and the correct ones as well. So I think she's been great, and so many of her exercises are free on her Instagram.
Amazing. And what's coming up for you in 2026, other than coming back and talking about the jaw, because we love you, so we want you back.
That's sweet. What is coming up? I'm doing a little course in January with a singing teacher that I work with, Derm, who's Irish from Galway, and that will be being released. And actually there's a few things that we touched on that we're going to be doing in more detail, mainly about navigating strengthening. I mean, I love information. I'm a bit of a nerd for new info, so I've got some more pelvic floor courses that I'm going to be doing. I am based at near Tottenham Court Road for Neuro Tour, so I will be there from Monday to Thursday, continuing working on the shows that I'm currently working on. Yeah, a couple more extra little ventures that I'm thinking about as well. So hopefully 2026 should be a fun one.
Where do we find you on Instagram and a website? Where can we kind of book in a session with you?
Yeah, so the Neuro Tour website is through something called the Jane app. So you can make an appointment there. My Instagram is physio.emer. So it's EMER.
Oh, thank you so much, Emer. You have rounded up 2025 for us so amazingly. So thank you so much for your contribution and your amazing knowledge that you've shared with us.
No, it's a pleasure. Thanks for having me.
Hey you! If you're enjoying the Singing Teachers Talk podcast, then don't forget to hit the subscribe button. We are committed to bringing you engaging conversations and valuable insights from experts across the field of voice. By subscribing, it means we can continue to do that. You'll never miss an episode, and you'll be helping to spread the word to other singing teachers, vocal coaches, and overall voice nerds. So subscribe to this channel now and just watch your teaching grow.